Welcome to NP Certification Q&A, presented by Fitzgerald Health Education Associates. This podcast is for NP students studying to pass their NP certification exam. Getting to the correct test answers means breaking down the exam questions themselves. Expert Fitzgerald faculty clinicians share their knowledge and experience to help you dissect the anatomy of a test question so you can better understand how to arrive at the correct test answer. So, if you're ready, let's jump right in.
The psychiatric mental health nurse practitioner has a new patient who reminds her of a former teacher who played an important role in her life and whom she regards as a mentor. The NP is concerned that she may express countertransference and is especially watchful for all of the following except A. Resistance and strong emotion from the patient. B. Dreaming about the patient. C. Extending appointments beyond normal time frame. Or D. Offering small, inexpensive gifts occasionally to the patient. The NP is concerned about countertransference and is especially watchful for what? Countertransference is absolutely one of those concepts that you want to be familiar with, not just for your clinical practice, but for your boards as well. I can virtually guarantee you that you will be expected. Let me say that again. I can virtually guarantee you that you will be expected to apply your understanding of the concepts of both transference and countertransference, as well as suggestions of each and your professional responsibility if they occur. So remember, countertransference is the concern that the NP will experience feelings or thoughts toward the patient based on past experiences or other biases and may project them onto the patient or into the patient relationship. So again, the question here is the NP is concerned that she may express countertransference and is especially watchful for all of the following except A. Resistance and strong emotion from the patient. B. Dreaming about the patient. C. Extending appointments beyond normal time frame. Or D. Offering small, inexpensive gifts occasionally to the patient. If the NP is concerned about countertransference, then that NP should be especially watchful for everything except A. A is the correct answer to this question because we're looking for the exception. And A is the exception. A is actually more consistent with transference from the patient. And of course, transference is the other concept you want to be familiar with. Transference is the potential that the patient experiences feelings and projects them toward you, the NP. Feelings that were developed in a different relationships, feelings and thoughts that were originally associated with other important people in the patient's life that are then projected on you. So A is more consistent with transference, but B, C, and D are all suggestive of countertransference. So again, the question is the exception. What's the exception? What's the thing the NP doesn't need to watch for? And A is the answer. If you're concerned about countertransference, then absolutely you want to be on the lookout for B, C, and D. Dreaming about the patient, extending appointments beyond normal time frame, or even on the flip side, being particularly rigid to the rules and not allowing things to go 1 minute beyond, like any action toward the patient that is different than the way you would act toward other patients. That's the thing that you want to be concerned about. Small, inexpensive gifts, they may seem like no big deal. They may seem like, no harm. And, if you are occasionally baking cookies and giving a little package of 2 or 3 to all of your patients, then yes, no particular concern there. In its own right, a little small, inexpensive token gift is not a concern. The real issue is if you are treating that patient any different than you are treating any others. Then that might might be indicative of countertransference, and that's the thing you want to be on the lookout for. So again, for your boards as well as your clinical practice, be familiar with both of these concepts. Transference is when the client projects feelings toward you, the nurse practitioner, that really were developed in a different relationship. And countertransference is when you, the NP, may project feelings on the patient, feelings that really were developed in another relationship. And that's not necessarily a problem. You just have to be aware of it and make sure that you can approach the patient in a non-judgmental, professional, objective way.
Thank you for listening to NP Certification Q&A, presented by Fitzgerald Health Education Associates. Please rate, review, and subscribe to this podcast. And for more NP resources, visit FHEA.com.